Welcome to the Women's Heart Health Summit. I'm your host, Dr. Mark Menolascino, Medical Director of the Meno Clinic in Jackson Hole, Wyoming. This is your chance to hear from international experts about how to achieve optimal vitality, achieve vital health, and prevent heart disease. We're fortunate today to be joined by another one of the world's experts, Dr. Jill Carnahan. Thank you for joining us, Jill.
Thanks for having me, Dr. Mark.
Let me tell our viewers a little bit about you. Jill's a personal friend of mine, one of my colleagues, and really one of my mentors. You've taught me a lot. You're someone I look up to, and I'm really excited to spend the next hour talking with you. Dr. Jill is your functional medicine expert. She uses functional medicine to help you find answers to the cause of your illness and the nutritional and biochemical imbalances that may be making you ill. Functional medicine is personalized medicine. It deals with the root cause of disease instead of just treating the symptoms. Dr. Jill will search for underlying triggers that are contributing to your illness through cutting-edge lab testing and tailor the intervention to your specific needs as an individual. She may use diet, supplements, lifestyle change, or medication to treat your illness, but she will seek the most gentle way to help your body restore balance along the least invasive treatment possible. Dr. Jill seeks to promote wellness, create hope, health, and healing by working with you. Dr. Carnahan moved to Boulder, Colorado in 2010, joining medical partner Dr. Robert Roundtree. She recently opened her own practice, Flatiron Functional Medicine, in Louisville, Colorado, to offer more personalized services. Dr. Carnahan is board certified in both family medicine and integrative holistic medicine. She founded the Methodist Center for Integrative Medicine in 2009, and she worked there as the medical director for integrative medicine services until October 2010. She completed her residency at the University of Illinois program in family medicine at Methodist Medical Center and received her medical degree from Loyola University, Stritch School of Medicine in Chicago. She received her Bachelor of Science degree in bioengineering at the University of Illinois in Champaign-Urbana, and she's a certified functional medicine practitioner. Again, she's one of the faculty of the Institute for Functional Medicine. She's one of my personal mentors. And Jill, thank you so much for being here.
Thank you, Mark. It is so exciting to be here and talk to you about women's health, one of my favorite topics. I'm excited.
Well, you know, I think a lot of us that come into this space, Jill, have a story that brought us into medicine. And I know you do. Can I ask you to share part of your story with our viewers?
You bet, because it really drives everything I do, and as any other of our colleagues that have stories. So I was a 25-year-old medical student, just riding along in the prime of my life, pursuing my dream of becoming a physician. And I found a lump in my breast. It was during my surgical rotation, ironically. Did not think anything of it, but I knew I had to have it checked out. And a short 2 weeks later, after mammogram, ultrasound, and biopsy all suspicious, I got a call from my oncologist, who was also a friend and colleague, because in medical school, you become friends with your mentors and the teachers that we work with. And she called me, and I remember her voice like cracking on the phone, because I could tell she didn't know what to say. She said, "Jill, I don't know how to tell you this. You have aggressive, invasive ductal carcinoma. You're 25. We know what this means in young women. A side note, I was part of a young women's group, all under 40 in Chicago, about 12 of us. And I'm the only one that survived."
Wow.
So this disease is a whole different ballgame in young women. It's very aggressive. It shouldn't happen in young women, period. And I was no different. So I had the battle of my life. And I remember sitting where, you know how it is when you have these moments in your life. I remember exactly where I was sitting and the color draining from my face as I heard these words, and like, my life is never going to be the same. I didn't know if I had 6 weeks or 6 months or 6 years, but I knew that this was serious and that I had to take it that way and really fight. Now, I now say, with all my stories that I've been through, I was born to overcome. So this was no different. This was my first journey of overcoming and my first challenge. So what I did is I did a lot of research and tried to find the best answers. And I ended up doing very conventional 3-drug chemotherapy with 5-FU and doxorubicin and Cytoxan. And these drugs are so toxic. They helped me. They cured me. But I feel like the last 17 years I've been dealing with the side effects of those agents on my system. And we'll talk about
17 years. Wow.
So it's almost like I beat the cancer through that. I did 3-drug chemotherapy, 6 rounds. I lost all my hair. I was so sick. I didn't even know how sick I was. But you've all seen chemo patients, and I was no different. I was down to the weight I had been at like 12 or 13 years old, like literally malnourished and bald. And then I got through it, and I did radiation after that. I did multiple surgeries, 3-drug chemo, radiation, and then came out about 9 months later. I had taken a leave of medical absence for the treatment. So I did basically just stop school and I did the treatment. And it was a good thing because I was really, really sick with the treatment. But got through the next spring, started back on my rotations, and I just assumed it was in my weakened state. I didn't think much of it. And I really am a fighter. So I was just going along, doing my thing. But I was so sick, Mark. I was having cyclical fevers, like up to 101.5 and 102 degrees on my rotations. I'm on the floors running a fever. No one knew it. I was so sick. And I started having weight loss even further, and then bleeding, diarrhea, pain. And I knew something wasn't quite right, but I just assumed the chemo, one of the things, Cytoxin has now been shown in my studies that one of the ways and mechanisms it acts is actually to increase intestinal permeability. So leaky gut, we actually creates leaky gut and causes this immune reaction across the membrane of the gut to cause the reactivation of basically the attack of the cancer cell. So all this to say, the drugs had a profound effect on my gut. And what happened in hindsight is they were the trigger. We talk about autoimmune disease and trigger, and they were the trigger to take me into Crohn's disease, which I was diagnosed with 6 months after my remission of cancer.
So the treatment for your breast cancer may have led to your diagnosis of Crohn's disease.
Yes, I have no doubt they're connected because I basically was a setup genetically for someone. I have the NOD, which is a high-risk gene for Crohn's. And then I was given an agent that caused massive increase in intestinal permeability, overload of immune system, which we know is one of the triggers to autoimmunity. And then I had Crohn's. And I remember sitting again with a doc I knew, gastroenterologist, and he looked at me and we were talking about it. He said, Jill, you're going to need drugs probably the rest of your life. You're going to need immune modulating agents. You're going to probably have multiple surgeries. And this is incurable. And I remember just sitting there, and we all have this intuitive sense and wanting to help people in medicine, and that's why we go into it. And I had this sense that there was something else, and I knew that his words didn't feel right to me. And I looked at him, I said, Doc, does diet have anything to do with this? Could I change my diet? And he looked at me and he said, Jill, diet has nothing to do with this. Wow. It's not going to help. And I literally, I didn't know much. I wasn't even into functional medicine, but I was holistic minded. I was always minded towards how to reverse and treat disease versus just drugs and surgery. And I was bound and determined to prove him wrong. I fired him and I went on the search through the literature and basically looked and looked. And I just happened across Elaine Gottschall's specific carbohydrate diet. And I thought, gosh, what do I have to lose? It's drugs and surgery or it's changed my diet. And ironically, Mark, from age 14 on, I'd become a vegetarian. And looking back, I was basically a carbitarian, eating like processed soy things and horrible for and then I also have the gene for celiac, so I was eating a lot of gluten. So no surprise, I changed my diet, took out all those things, took out dairy, gluten, sugar, and all the specific carbohydrates that she talks about. And within 2 weeks, my symptoms, the fevers, the bleeding, the pain were gone.
That's fantastic.
Now, I wasn't cured, but that was obviously an eye-opening to like the profound effect of diet and food on our health and on our gut. So that awakened me to like, oh my goodness, there's answers here. And it was several years till I really rebuilt my microbiome, and that's how I did it. It's like starting from the ground up, healing the gut. And people now, I'll like post or talk about it or blog about it, and people get so funny. They think, they're like, oh, Jill, you mean remission, don't you? Kind of like, oh, honey, you're mistaking your words. And I'm like, no, I'm cured. I have no evidence of Crohn's. This is not remission. And I think it's hilarious because it's cured. I do not have Crohn's anymore.
Well, your attending doctor must have been right that nutrition obviously had nothing to do with it.
Right.
Isn't it fun when you see, especially women empower themselves like you did to figure this out on their own?
Yes, so and your listeners, I mean, that's the biggest point today is if I can give you hope and encourage you to listen to Mark's seminars, listen to all the people who he's interviewing, because there are answers, and you're probably not going to hear all of this from your regular physician, unfortunately.
Yeah, there's so much that we weren't taught in medical school. And What do you think is unique about your path that got you interested in looking at these alternatives? Was there a moment or a mentor, or what really helped you open the door to look at all this?
So I grew up in a really healthy family. We had
Mhm.
gardens, and of course they were organic. And my mom always, made canned and froze foods and fresh fruits and vegetables. And so I grew up in a family that was health conscious. And so I knew going into, in fact, I had looked at all kinds of different like naturopathic schools and traditional Chinese medical schools because that philosophy fit better with who
Mhm.
I was. But I remember applying to the Chicago medical schools and getting accepted. And I thought, I have a crossroads here. And I think the best route is to infiltrate the system and actually change the way they do things. So I knew before I went in that I wanted to be different and that I didn't fit in the mold. But it was a catalyst when I got cancer and really dealt with my own health battles and saw the power of nutrition. It completely put me on fire. It let me on fire.
Well, yeah, it's interesting. You talked about how you were a vegan at age 14, but you weren't really a healthy vegan, and I think that's something that a lot of people fall into that trap.
Yes.
Do you see that a lot in your practice?
I do, Mark. And I think speaking to women today, this is so important because I see now eating disorders and vegetarianism, unless it's for ethical reasons. A lot of these young girls, there's zinc deficiency driving this lack of taste for meat. And there is all kinds of nutritional deficiencies. There's things like hypochlorhydria, which is basically lack. I have all these things that were part of my history
Mm.
where you don't produce enough stomach acid. And so anytime you eat a heavy piece of meat, it feels like you don't feel well. And so they gravitate by nature kind of towards a vegetarian lifestyle because they feel better just eating plant foods. But it's really issues that need to be dealt with, like the digestion and the nutritional deficiencies.
Eating disorders, we have a specialist here in Jackson Hole. It's really opened my eyes to how big of a problem it is. It's the number one cause of death in young women aged 19 to 35
Wow.
is eating disorders. And then the next one is heart disease. And it's a pretty scary number. And I think there's so much marketing misinformation and very few doctors like yourself that can give good advice about nutrition to young women.
Yeah, and it's so sad because it's considered a psychiatric diagnosis. And certainly there are issues, but I think the real issue is say I'm seeing them for the first time, is make sure we rule out nutritional issues and digestive issues first, because it's a label otherwise, and it doesn't really get to the root cause.
And I know you have ways to test for this with your clients to look at these nutritional deficiencies and these digestive dysfunctions. How do you evaluate for that in someone? What's kind of your go-to strategy to um, to lift up the curtain and see what's really going on?
Yeah, so say a woman walked into my practice and it's anything from the cardiovascular risk that we're primarily focusing on here to fatigue or headaches or some sort of fibromyalgia like pain syndromes or hormone disorders. And they all go together because the same types of underlying dysfunction will lead to these late term effects that present with headaches or fatigue, but they're really at the core, we can look at the same things. So
Mhm.
say a person walked into my office, I would usually do blood work first and do whatever I can through their insurance. And you can get a lot of things like zinc and magnesium and selenium and B vitamin levels through routine labs. And I
Mhm.
will often do that to start. There's a lot of specialty labs out there and that we can actually do intracellular nutrient testing. So those are great if you really want to scan one of the patient that walks in your door. I almost always do a stool test because I know how much the gut affects the brain and the heart and every organ system. And remind me, I want to be sure and talk about the gut microbiome and the heart, Mark, because I just spoke on that in one of the events. But back to the testing. So the stool is absolutely profound because if your gut isn't working and you have organisms that are going on shouldn't be there, then that's a big problem for the whole entire body. And then organic acids I really like because I can look at a lot of different metabolic function and nutrition pieces and neurotransmitter function from that perspective. That's usually urine testing.
And most of the clients that come to see you, they didn't even know these tests existed, right?
Right, exactly. They're just
Right.
counting on me to be the detective and go deeper, and so I do that. Infectious, I always think of it as really quite simple. And we're talking about nutritional deficiencies, but at the core, the more complex cases, it's almost always toxin or infection. It's really often a toxic load thing or an infectious burden. And those two things, if we're looking, we'll usually find answers by looking at those two areas.
That's such a great point, Dr. Jill. Really, all of the disorders you see have this common theme, And it's usually a toxin theme or a gut dysfunction theme
Definitely.
in almost all of them. And you're one of the world's experts in both. And if you would, when someone comes to see you, I know you're so observant and you listen so well. Are there things that you can just see on people that give you hints about what's going on? We talk about the tongue, the nails, the skin. Can you share some of the physical signs that are pearls that you see in people?
Yeah, so and mast cell disorders are huge, and it's a whole nother topic, but that's often very visible from allergic dark shiners, kind of a darkness under their eyes or a puffiness under their eyes, any sort of a redness to their skin. If they have scratches or hives or rashes on their skin, those are all common themes. You can see in someone's eyes their brightness, their alertness. If they're all there, you can see it, the vitality. Like I would give every patient that walks in a scale of 1 to 10, their vitality level. And so I'm kind of gauging that vitality.
Mhm.
Even their tone of voice, their demeanor, how they present themselves is part of the picture because if they're overloaded with toxins and infections, they tend to be more pulled back or more fatigued or more just overwhelmed in general. If there's a toxic exposure like mold, they're going to have more trouble with comprehension and they're going to be taking notes or recording your interview or not following you. And so those are all things that we see real frequently. Shortness of breath, if they're having trouble getting up and down out of the chair, many lung issues, coughs, congestion, clearing their throat. Or I often look at their tongue. That's one of my favorite things to do because you can see a sort of a dark brownish kind of coating can be SIBO. White coating can be thrush or candida or SIFO. And then just if there's ridges on the tongue, that can be digestive issues. If there's cracks and fissures, that can also point to issues. So the tongue is very telling, just like traditional Chinese acupuncturists will frequently look at that. Skin is a big one because you can see a lot through the skin. We know rosacea is associated with SIBO. And so if I see a rosacea pattern, we see often like a butterfly rash with autoimmunity. So I'll look at skin is a big one, eyes are a big one, tongue is a big one. And then, of course, there's all kinds of other things. Nails, if you see some white spots on the nails, it's often zinc deficiency. If you see vertical ridges, they can have a lack of protein absorption, so often hypochlorhydria. The horizontal ridges are often more liver related. So there's just a few things.
Well, that's again the observance that you have just to see the whole picture before you even open their chart or even order one test. You have a lot of information that you have there. Jill, you mentioned SIBO and this new thing called SIFO. Could you talk about both of those a little bit?
These are so common and people don't even know they have it. Our microbiome, which people have heard about, is the organisms, the gut bugs that reside, and they should reside in our colon. And they should, our small bowel, which resides right before the colon, right after the stomach and beginning of the small intestine, this area should be relatively sterile. And so the problem happens when either you have troubles with breaking down fats and proteins and you get overgrowth from the upside down, or you get overgrowth from ileocecal dysfunction or trouble with bile acid production or short chain fatty acids and overgrowth in some other way. But it's incredibly common. It's also common. I was just talking to another doc about bile acid insufficiency, and bile acids by nature sterilize the small bowel, and they're a big part of keeping that area pretty clean. I always, when I'm teaching about it, I talk about it as, you go to the hockey game and during the intermission, the Zamboni goes across the ice and just clears off that, makes it a perfectly smooth surface. We have a Zamboni in our small bowel, and it's called the migrating. Yeah, great analogy, right? You can just see it. And you can see that coming across. It's called the migrating motor complex. And between our meals and at bedtime, that goes to work. The Zamboni clears out our small bowel. And so this migrating motor complex, if it's not functioning because of autonomic dysfunction, so a lot of patients with chronic tick-borne infections or diabetes or some neuropathy types of things, they can have this where they are not clearing out the small bowel. And it tends to just be like a pond with pond scum, and there comes overgrowth and biofilms. And the problem here is this is the area where we break down nutrients and digest foods and get all absorption of things like vitamin K and A and D and iron and B12. And so if this is not functioning, we have impaired absorption of nutrients. We have malabsorption of fat-soluble vitamins. We can have pain, gas, bloating. We can have just all kinds of symptoms. Even systemically, it can overload the enterohepatic circulation, which is a fancy word for saying the junk that gets filtered out of the gut into the liver. And so the liver, you can have fatty liver from this. You can have issues with liver and detoxification. And we always talk about toxins from the outside. like mold and metals and chemicals. But this is one way where we get toxic from the inside because our bacteria is producing a ton of garbage and we have no way to filter it all out. So it's super common, and often with the SIBO, that's the bacteria, we have SIFO, which is fungal. And this is where, like the white coating on your tongue, you might see women, this is actually really common because hormones actually play into this and will make it you more likely that you have issues with yeast.
Well, I know when I talk with other doctors about yeast and candida, they think about patients with immune diseases like HIV having these fungal infections, but it's much more common than everybody thinks, right?
It is so common. So anyone who has blood sugar issues is prone to it. Anyone who has been on steroids for any reason is prone to it. Any woman who's on birth control or some sort of hormone, exogenous hormone from the external, is prone to it. And then nowadays our diet is so full of processed carbohydrates and sugars that will absolutely feed the overgrowth. So I see it so common in young women, and they will often have brain fog, fatigue, carb cravings, really bad painful periods because it plays into the hormone cycle. They'll have the white coating on their tongue, they'll have gas and bloating, and they'll have frequent vaginal yeast infections or toenail fungus.
Well, I know 25 years ago, 3 women came to me from another town, told me about it, and asked me to figure out and fix it. I'd never really heard about it. And they were right. And I love it when our clients teach us things. You must have people come see you with bundles and journals and Dr. Google printouts and all types of things because they've been to multiple doctors before they see you.
I do, and I love it. I love it.
Yeah, I do too.
I think the one thing that I enjoy the most is taking complex and lots of data and trying to look at patterns. It must be the engineer in me, but I like the more data, the better. And I take all of that. And then that's where, you asked before, like looking at physical signs, but the great physicians like you, Mark, and I hopefully myself, we take large amounts of data and we use that intuitive self that it's been suppressed in medical school. And then we prove it with the science. You and I both love science and we stand on a great foundation of science. But the truth is my best intuitive diagnoses are always right.
Well, I've always said the smartest person in the room is a woman's intuition, and we better listen to her because a lot of times she's right. How many times do you have a woman come see you that she already kind of knows what's going on, but she's never had anybody validate it, test for it, confirm it, and know what to do with it?
So true. And how many times have you asked, what do you think is going on?
Mm-hmm.
Have you ever said that? And then
every consult, I have to say it. Yeah.
I know. I love it because they know. And if we just listen, that's half the solution.
Well, you're a teacher of your clients, but you're also a teacher of doctors. You're the doctor's doctor and teachers of all of us in medicine, integrated medicine, functional medicine. You mentioned the microbiome and the heart, and I know I've heard you lecture on this. Can you share with us how you think of that relationship and how you share that with your clients?
You bet. So this is so interesting because we always knew, the gut, obviously immune connection, easy gut-brain connection. But more recently, we're seeing so much data on the different species in the microbiome and the heart. So there's a couple different things out there that are at play. One is this concept of TMAO, and I'm sure you have someone talking more about this. I'm not the expert, but I'll tell you what I know.
Please.
What I know to be true is those who are more of a carnivore lifestyle, so they've eaten meat all their life, they tend to have a shift in the microbiome that will take L-carnitine from meat, and especially red meat, and turn it into TMAO through the liver. So they're going to be more prone. TMAO is cardiotoxic. It's a harmful thing for the heart, and it makes patients prone to atherosclerosis and heart disease. So it's not a good thing. But what we find is the vegetarians, or the ones who are more plant-based, they can eat meat and they can eat fish and chicken, and for some reason their microbiome doesn't turn it into TMAO. So it's not just that someone eats meat, it's someone who eats meat with that particular microbiome profile or fingerprint that turns it into TMAO. So the story is much more complex, and I don't believe in and of itself red meat is all bad. It's just the patients who have the microbiome that turn that into TMAO do have a riskier profile. So that's interesting to me because it's all about the microbiome and what it does to our food. Another thing that's really big, we hinted at this earlier, but it's endotoxemia. So long word for the process of basically bacteria, the coatings of bacteria from crossing over from the gut lumen inside the gut into the bloodstream through a permeable gut membrane. And this is also called LPS, lipopolysaccharide. It's such a toxic, one of the most potent immune stimulators known to man. And it's responsible not only for cardiovascular disease, obesity, metabolic syndrome, insulin resistance. It's also responsible for mood disorders like bipolar, schizophrenia, insomnia, depression, anxiety. Even there was a study with men with low testosterone and endotoxemia. So these crazy varied effects of endotoxemia, it's incredibly common because a lot of times the docs will ask me, how do I test for leaky gut? And my funny answer, which is true, is I assume everybody has it. I don't even test because the standard, I don't know of any person I've ever treated that doesn't have some degree because of our toxic world and our food supply and our stress levels. So all of this, basically that lipopolysaccharide, the coating of the bacteria, crosses over into the immune system, creates damage. It's like a little, the Titanian devil, remember that guy? He'd do the little whirlwinds, or the Tasmanian devil, I guess is his name. So he's like the LPS is like the Tasmanian devil in your immune system, just stirring up trouble. And so that will often trigger this problem. And with cardiovascular disease, it's one of the biggest risk factors. So far we have the TMAO story. We have the LPS-induced endotoxemia. And then one of the other things we have is the diversity of the bacteria in your gut. And you would think when you say diversity, you think, oh, it's just the number of, you just count up the number of microbes and then that equals diversity. Well, it's not so simple because we know there's very certain species like Collinsellia and Akkermansia that highly correlate with diversity. And if you don't have those, by definition, you lack diversity because those are some of the indicators of diversity. And we know that certain ones like Akkermansia are associated with decreased cardiovascular risk. This is kind of like, so diversity is everything when it comes to the gut. And when I'm teaching, I always talk about the Ireland's potato famine. All these farmers got smart. They grew one type of potato. They all got the same type of seed. And what happened, there was a blight and it wiped out everything because there was no diversity. And it's the same with our gut. When we have diversity, multiple species doing more than one thing, we kind of have a backup. And so we're less likely to be prone to disease because we have that resilience. So diversity breeds resilience, and it's all related to cardiovascular disease because if you don't have these certain species, you're going to be more prone to heart disease.
And Jill, how do you tie that diversity providing resilience to stress? Because we have a link of stress in the heart. Does it go through the gut?
There is definite evidence that this is part of the puzzle because basically the stress levels, increased levels of catecholamines will increase levels of things like Clostridia, which we know is not good, and decrease levels of lactobacillus. So there's definitely a correlation with stress. And I think it just impacts the ability for that microbiome to flourish. It's almost like the stress impacts their ability to proliferate and be diversified. It's kind of like your 401k, right? It needs to be diversified.
You know, there's a couple sound bites I use in my practice that someone shared with me. The idea that there's 10 times more bacterial cells in your gut than human cells in your body.
Yes.
And that half the DNA inside of you is not yours. It's these bacteria. Yeah. So once we start to understand the depth and breadth and diversity of this group of friends that we are hosting, who might actually be hosting us, it's amazing how little we used to pay attention to that ecosystem. We thought the brain was a black box. We thought the heart didn't communicate. We thought the gut was just an elimination transport highway. It's neat to see how these are all coming together.
It so is. And it's neat to see, like, so many of our drugs, I think that we're continuing to find out they act through the microbiome. And like you said, could it be that stress acts through the microbiome? It might be this pathway that impacts a lot more than we really think it does.
Well, we talk about leaky gut, leaky heart, leaky brain, that a lot of these mechanisms are similar in all three areas. And that may be where this symphony comes into balance. You know, the microbiome is such a hot topic, but, you know, one of the things you've really taught me is toxicity, biotoxins. And Jill, if there's one thing I think that allopathic medicine, my colleagues in internal medicine, we have not figured out or even cracked the shell on, is on toxicity and biotoxins. We want to pretend it doesn't exist, that our world's not really that toxic, and that it doesn't make a clinical difference in people. When is this going to come mainstream? What's going to have to happen before all doctors realize that we've got to be looking for this? And a lot of the people we can't figure out, this is what really has been going on with them the whole time.
You always say it before I even think it. You say it, and that's exactly where we're headed. This is the elephant in the room, and this is the thing that docs don't realize is there and causing. Docs. I mean, docs know the health of our patients is going downhill. And don't you remember back when you just had like a sore throat? Like I never get those simple cases anymore, which is fine, but the complexity is astounding. The level of complexity. And I think that speaks to the fact that our bodies are completely overwhelmed. And what's happened is all the stuff that should nourish us, the food, the air, the water, is all toxic. So even the ways that we get nourishment and basic necessity for life, they're all toxic. I think Walter Kreenan quoted that 80% of our toxic load is from the air we breathe. And then Dale Bredesen did the inhalation of Alzheimer's work. And so we see that air we breathe is like the first thing that we need to look at. I went to Switzerland recently, which and one of the most profound things I learned there was no EMF. The air was perfect. The water was perfect. The food was perfect. I felt so amazing. And I believe it was not the treatments. It was just the environment. It was like the elephant had lifted. And I'm a canary. I'm one of the sensitive ones. So I could tell such a dramatic difference. It was just profound. So people don't know that they're just swimming in toxic soup. And people listening, you've got to take charge of your health. Your doctor's not going to do it for you. You've got to make sure your air quality first is clean. If you have to get air filters, check your air quality at home and work. Water, simple, basic nutrient for life. You have to make sure you have clean water, not in plastic water bottles. And the food. And you don't have to get all fancy with a bunch of detox or supplements until you get those three straight. So clean air, clean water, clean food. We can all do that. You don't need a physician to help you. It's really, really important.
So better than detoxing is not trying to get exposed in the first place.
Yes. And people forget they go on these 21-day detoxes and cleanses, and those are great, but you've got to get the basics. And I'm such a proponent of teaching people daily tips. I practice it myself. You want to get a habit or patterns that keep you healthy from exposures every single day. So whether it's you're taking an Epsom salt bath or using infrared sauna 3 times a week or just eating clean organic food, it starts there and you don't need a prescription.
So these are all simple things that people can really do on their own, like an Epsom salt bath.
Yeah.
But really it starts with what they're putting in or on their body.
Yeah, so that's a whole nother issue. And with the history of breast cancer, I remember right after thinking, oh my gosh, the chemicals are affecting me. Just a little bit more of my story. I grew up on a farm. I have horrible detox genetics. And with a 25-year-old diagnosis, there's no doubt that I could have even had in utero exposure that led to the cancer. Like I believe very strongly, my mother, while I was in the womb, that started the event. And people have that hard time believing, but you and I know these cancer cells are not quick. They actually start years and decades before. And so I think that was the case. So when I got the cancer, I was like, wow, I've got to clean up my routine. And women out there, I know you use like me, hundreds of bath and body and makeup products. So you've got to look at these labels and get rid of the phthalates and the parabens and the SLS and some of these toxic chemicals. There's online sites that have downloads so you can actually look at what chemicals are toxic. I've written about it. I'm sure you've written about it, Mark. But making sure the things that you put in your house, on your body, on your children are non-toxic.
So really it's taking your cosmetics, your beauty products, your food, your medications, your supplements, and turn them over and look at these inactive things and these other ingredients. It's pretty amazing. Jill, we've lectured together so many times, and every time you're lecturing, I sit there and you pique a thought of someone I've seen before that lets me think about them differently. And I know you get up every day and you look at journals. You're a student at your core, and you have a practitioner log that you share with other practitioners. How do you stay ahead of all the information? There's such a avalanche information coming down. How do you do it? And how do you tell your clients to sort the wheat from the chaff, so to speak?
Yes, because this can be overwhelming. I remember when I was diagnosed with cancer and in medical school, so I had a medical education and I was completely overwhelmed by the decisions I had to make about chemo. And I remember that was my first introduction to what the patients are facing, with this massive onslaught. I had a medical degree. I could read the journals, and I had stacks inches thick on just a decision for post lumpectomy radiation and what kind and how much. And then I would have another stack for just what types of chemo and side effects. And so these decisions and this daily stuff is not easy. But what I recommend is you get a few people you trust. For me, it's like professional journals and subscriptions to their contents. And I know in my inbox every day, I'm going to get a little bit of information from sources that I trust. And then I filter through that. So, and that'll often, like you, Mark, I will see something that'll pique my interest, like laser therapy. I'm like, this is so cool. So then I'll dive in on PubMed and say, what's out there? Or I'll do a lecture on Crohn's disease and I'll say, what's out there for Crohn's? And then I'll just do searches on PubMed and find some pretty amazing stuff. I remember a patient with Crohn's that I had this very specific hemorrhagic E. coli bacteria that I found, and I treated and its Crohn's went away. And I was like, that's cool. But I didn't know there was any back that. So I did a search in the literature, found a paper specific on that strain and Crohn's. And I was like, wow, this is why. And then I could teach about it. But there's stuff out there. And again, I do free blogs all the time. And so I try to put the information out. But if you have someone that you trust and you can get knowledge from as a patient or as just a layperson, there are people you can trust. And don't believe everything you read, because there's a lot of junk out there too.
Well, that brings up a good point about how you assess people, and it's looking at this whole person, this personalized root cause type of approach. There were so many things we were both taught that it's a pill for the ill and you just patch the symptoms and reduce it to the smallest pieces and fix that piece one at a time, rather than looking at the whole system. The person as a symphony and brings the whole person. Do you have people come see you that are stuck in that model, that don't really understand about doing the system approach and a personalized approach?
You mean practitioners?
Well, both practitioners and clients that have been kind of almost brainwashed that that's the only way that you can, is identify a symptom and treat it.
Yes.
Like it's rheumatoid arthritis, you must use this drug for it, rather than looking back at, well, why do you have rheumatoid arthritis? What's your story?
Yes. Oh, this is huge. It's basically, you and I both, we're way more than physicians. We're educators at the core. And so teaching, whether it's teaching the patients or teaching and that's why things like the Zamboni are really important, because people get it.
I love that analogy. That's great. It's really
totally
the best one I've heard ever. I like it.
But those are I actually literally think about those things. I know you do too, because you've got great stories. And I'm thinking about, how can I explain this in a way that they would understand? And then it makes it in their terms. And even for me, it's like, oh yeah, that light bulb goes on. And doctors too, I have so many colleagues that are so hungry. I remember when I was in medical school and right out and starting into the functional medicine, people thought I was nuts. And now my colleagues are calling me because their son or their daughter or themselves or their mother is sick and they don't have answers. And anyone in conventional medicine knows that there's a limit to what we can do. And so they're going to at some point hit a wall. And it usually happens when someone close to them gets ill, because they realize in a personal way they don't have the answers they thought they did. And so I think just being open-minded to that, and then knowing that our role is not just physician, but it's educator, is really important.
Jill, you and I were both taught in the evidence-based model that we have these bell-shaped standard curves of normal, that we regress every individual to that average population. And evidence-based medicine makes sense unless you're an outlier.
Yes.
And so I know you practice the N of one. You look at each individual. How do you balance what shows in studies for populations versus that unique person in front of you?
Yeah, this is a challenge, because I think what I try to do is use that intuitive sense. It's not science at all. It's just what intuition is pattern recognition. It really is.
Yeah.
And a good intuition is a subconscious pattern recognition. And I think the more complexity sometimes actually helps us with that. So my approach is actually really, I think in medical school, that's kind of shifted out of us, because we're taught not to ever use that. And so we doubt it. We doubt that it has any validity. I know I did.
Yeah,
and then I realized my gift is intuition. I'm a very intuitive individual. And then when I start to trust that, and then what I do, like you do, I prove it with science. So say I have this hunch, we'll call it a hunch, that someone has a certain issue or disease or problem or process, then I'll go, okay, I want to test to prove this with the best science. And what patients don't realize is even our best test, they are fallible. And there's outliers, and there's things there that aren't valid, and we might get a false result once in a while. And so even our best science is still full of the art and not the science. And so I use the science, but I know that it has limits too, and no test we have is perfect. So you kind of try to balance that, and because I do want the validity of having the test. And, you know, some information we hear 5 years ago, 10 years ago, we find out now it's totally not valid, and we believed it, and even in the conventional world. So I think we just have to go in with a very cautious approach and always being aware of our fallibilities, because we're human and we bring our human bias to the picture.
I remember my first day of medical school, the chancellor told us everything you learn in the next 4 years, half will be proven false by the time you graduate. Your job is to figure out which half.
Yes.
And in science, we're okay with what they call a p.05 or a 5% statistical probability of being wrong, which means 1 in 20 times we're okay being wrong. That's okay if you're the first 19, but not if you're number 20.
Right.
Those numbers are actually, for a lot of tests, are much, much higher.
Yes.
So a positive test versus a negative test, they all carry different weight. And they're not the absolutes that I think a lot of us were taught and what a lot of our clients think.
Yeah. And I'm sure like me, I've had times where I've been using a test and then I realize this is not as valid as I thought it was, and I'll stop using it. But I have to always be on guard for what I'm trusting, because I'm trusting patients' lives to that data. And then later I find out, oh, this isn't good data, this isn't good science. And I'll admit it when I know, but we do that all the time because we don't know.
Well, that's where I think some of this advanced testing is so exciting, because it shows you these patterns that explain what you're seeing.
Yeah.
And you talked earlier about intuition, and your intuition gets stronger the longer you're doing this. You have a wisdom of experience of 2 decades of seeing patients that you see these patterns over and over. And the story might be a little different, but the pattern's the same. And this pattern recognition really is a powerful tool to have.
That's very true. Experience is a lot, because over time you're like, yeah, I've seen this before, I think. And then what you do is just make sure that you're not jumping to conclusions, because we can do that too. But usually if we see that same pattern, it's often the same animal.
So, Joy, if I could ask you and put you on the spot a little bit, I know everybody's talking about the paleo diet, the ketogenic diet, the intermittent fasting diet. I'm sure so many of your clients come ask you and say, Dr. Jill, what diet should I do? How do you start that discussion? How do you move through it? Where do you end up with that?
Yeah, so this has a lot to do with microbiome, because if we get something really restrictive and narrow, we're going to restrict what we're feeding our microbiome, and we're going to remember that diversity we talked about. We're going to lose diversity. So I use those as tools, and I have things like the low FODMAP diet, the Candida diet, the GAPS diet, the SCD diet, the keto diet, the paleo diet, the autoimmune paleo diet, and there's more. Those are just a few. And there's so many. So I use those as tools, because in the beginning, what you want to do is teach the patients how to own what they eat and own the symptoms that they may or may not have with food. And usually people are completely oblivious of any connection to their symptoms and food. And what I want to do is just get them the buy-in so that they can say, oh my gosh, so for example, say they go on an elimination diet, the top 7 would be corn, gluten, soy, dairy, egg, sugar, alcohol, and maybe peanuts. And they go off those foods, they start to feel better. And then they go on a binge on a weekend and have, barbecue chicken and gluten and milk and all kinds of things they shouldn't have. And they will come back to me. It won't be me telling them. They'll come back and say, oh my goodness, Dr. Jill, I went off the bandwagon. I feel so horrible. I will never do that again. And I don't have to tell them, and I don't have to reinforce it. They have reinforced the behavior by the awful outcome they had. And so all I want them to do is start to identify, what do you feel good with? Do you feel good when you go into ketosis and do intermittent fasting? Do you feel horrible because you can't digest fats? And which piece is that? What I found for most people is a lot of the community that doesn't really understand, I know you and I do, but they think keto is all bacon and eggs and fat. It's okay to do that short term, but you are starving the microbiome. So I don't love it long term for most people. And I'm a big fan of a plant-based diet no matter where you're at.
Mm-hmm.
And so even for me with cancer, I feel like the majority of our diet should be plant-based. It feeds the microbiome. So even if I myself am doing paleo or keto, which I've done both, I'm still primarily eating plants. And for me particularly, I don't do a lot of red meat just from my history, but I have no problem with good grass-fed red meat for a lot of my patients. So it just depends on the person, but the commonality would be plants are key. And there's no doubt the data supports that plants are important for the microbiome and for our overall health. And
Well,
I don't mean vegetarian. I just mean with a carnivore diet, you still need plants.
so you talk about plants feed the microbiome. Can you explain that a little bit more?
Sure. So all of the fibrous foods, and typically that's things like legumes and starches and resistant starches, and then the fibrous things in all of our broccoli, cauliflower, cabbage, bok choy, all those vegetable fibers. Those are the things that actually feed the short chain fatty acids, which over and over and over again studies show prevent cardiovascular disease and aid with small bowel digestion and SIBO and those kinds of things. So having those plant-based foods really feed the microbiome just by the fact that there's a diverse group of fibers that they bring to the diet.
And probably the best way to kill your microbiome is with these toxins.
Yes.
And I know this is a huge topic we could spend hours talking about, but this whole story of glyphosate with the Roundup, and I think a lot of people hear it, but they don't really know why we should be so worried about it. What do you tell people when they ask you about it?
So glyphosate or Roundup, first of all, I want to differentiate. Right now we have some tests that test glyphosate, and we talk about glyphosate because that's the generic active ingredient in Roundup, where they call on their label and say this is our active ingredient. The truth is, and this has been proven, and there's studies all over Europe that show this, Roundup is about 1,000 times more toxic than glyphosate. It has a bunch of surfactants that actually make the chemicals more toxic. And besides labeling the glyphosate there, they don't have to reveal all the other toxins they include. So I want to actually call out Roundup as the toxic, really toxic chemical that it is, because people don't understand that either. So when we test glyphosate, we're testing a marker, but we're not really testing the toxic load that Roundup brings. So Roundup and glyphosate were originally developed as mineral chelators, and then they found that as they chelated the minerals, they would kill off the plants. So it's an herbicide. And this same chelation happens in the gut. And when they studied Roundup on human cells, they said, oh, it's non-toxic because it doesn't affect human cells. What they didn't study was its effect on the microbiome. And it has a profound effect because it pulls the minerals from the microbes that they need, like molybdenum and trace minerals. So those microbes like Lactobacillus bifidobacter, the good guys, they can't survive. And it'll kind of kill off some of the good guys and allow things like Clostridia to overgrow. There's clear evidence in animals now, like cattle are getting versions of C. diff colitis, the human kind of, diarrhea and bleeding and that we have in the cows, and they're dying. And the pigs are getting a version of a gastritis and dying at epidemic amounts from that effect. So it changes the microbiome diversity. It kills off good guys. It chelates minerals, so they're not available for use by the microbes or for use by us. And it changes some of the protein. So say we eat a sandwich that was sprayed, the wheat was sprayed with Roundup, that protein to our body looks different. So it increases antigenicity, basically increases allergic response, and increases the risk of things like celiac disease because it's kind of a different molecule to our body.
You just summarized an incredibly complicated topic in just a couple minutes. That was so easy to hear. Two of my favorite patients, Bert and Lee, were cattle farmers in Wisconsin, and they found in their area of Wisconsin that was very mineral depleted, and a lot of the calves didn't do well. So they actually tested the blood of several of their calves, found the mineral deficiencies, and were giving them nutrient IVs.
Wow.
And their calves did so much better. They developed the nutrient IVs into a special type of salt lick that was unique to the deficiencies of that area. And they had said, this was 30 years ago, that it was the minerals affecting the gut. And now you have the science of that as well. And you throw the toxicity in there, and it's a triple whammy for people.
Yeah, it really is.
Jill, I love how you study so hard, you learn so fast, you share so much. You're a fantastic clinician. You're a teacher of teachers, a teacher of doctors. How do our viewers find you? How do they connect with you if they want to learn more about you?
Oh, thank you, Mark. I feel the same about you.
Thank you.
You're just brilliant and great clinician. So my website is full of tons of free resources. So that's the best way to find me. And it's just my name, Jill Carnahan. That's JILLCARNAHAN.com.
And what are you excited about? Do you have any projects you're working on? Well, what's exciting in Dr. Jill's future?
So I am getting ready to publish some case studies in autoimmunity and successful outcomes to kind of show
Great.
that the insurance reimbursement world, we have 10 case studies that have shown really good outcomes, and getting ready to publish that with a functional medicine group. So real excited because I think that'll start to change. And even for clinicians who don't really know what this is, hopefully they can see that there's validity, because these are really good cases and their outcomes are good and they're science-based. We have all the references there. So that's been really exciting. It should happen in the next 6 months. And then hopefully my book will be out next year on my own
Great.
store. More to come.
Great. Great. Well, Dr. Jill, it's always a pleasure. You always get me thinking and make me want to work harder at what we do. And thanks for sharing your passion of medicine today. Thank you so very much.
You're welcome, Mark. Thanks for doing this for women.